Good morning, Dr. Melson.
Morning.
So now we're on the subject of integral medicine. Can you give us more about this, and in particular, what is integral awareness medicine?
Yes. What I've been intending so far is to give a spectrum of a progression historically, and a spectrum in terms of understanding these different terms, so that we can be a bit more accurate in the use of the terms. Previous discussion, I outlined a little bit about that history, the historical progression, and I'd like to highlight more in terms of what some of this distinction is between integral medicine and integrative medicine, and then to go into this spectrum of integral medicine itself, culminating in what we call the integral awareness layer of the integral medicine. So, but if we consider within this construct of integrative medicine, the most simplistic level of integrative medicine that we see usually is a patient goes to their regular doctor, so to speak, their allopathic doctor, and that doctor is in a clinic environment, Western medical clinic environment, assesses the patient, and then maybe sends the patient or allows the patient to contact healers and technicians and practitioners in other disciplines. For example, back injury, you can go see the physiotherapist for some aspects of the back injury. If you're interested, we can refer you to an acupuncturist, or perhaps the physiotherapist does acupuncture. From the standpoint of some interest in mind-body kind of integration work, we have someone that we can refer you to, perhaps a psychologist, a clinical psychologist, or perhaps someone who has been trained in neuro-linguistic programming or hololinguistic awareness, or various other types of mind-body integration. And someone over here who may be a body worker or a massage therapist, or someone over there who may do some kind of herbal or homeopathic approaches to things. These are separate, disparate kind of entities, and the coordination takes place from that clinic, from that doctor who happens to have an open mind and something of an open heart approach. You can get more integrated in this process when you start to have facilities that have multiple practitioners under one roof, and they have a more or less loose agreement that they would cross-refer patients to one another. The patient may come through any one of those practitioners primarily in the beginning, and then that practitioner, if it is someone outside of allopathic medicine, has a relationship with the primary allopathic doctor there in the building, or there within the center, or within that network, and then they begin to coordinate some of the care. And you know, this represents another layer of the integrative type of level. A higher level of integrative is when all of these practitioners are in a more or less dedicated relationship with one another, and there is a primacy still to the allopathic approach, yet the patients may come into the system through any of a number of these practitioners. They then refer to the allopathic doctor, who does primary coordination of care. They create a coordinated care plan, and there's an understanding that there may be a sequence of one type of care, then another type of care, or corresponding and simultaneous aspects of care. At the highest level of integrative, we really are talking about what begins to become a prevailing philosophy. That prevailing philosophy of how each patient will be addressed more or less with respect to spirit, mind, body concerns, social concerns, etc. And once again, though, it still tends to hold the center focal point as allopathic medicine and the physician in that role. Yet this is kind of thing that is, at least people are buying into sort of a common integrative, highly integrative approach. And many of these priorities that the patient has a sense of for herself, himself, will be addressed not simply by the allopathic doctor, but actually given back as information to the patient, education to the patient, as how they intend to go about a coordinated stream of care to this person, highlighting these particular areas of concern and what the approach to that area may be from this discipline, from that discipline, from another discipline. That's the first half of this. That's taking us to sort of the heights of what we would call an integrative program. Integral, therefore, takes that and then goes further beyond. So integral medicine then looks at, as I mentioned briefly before, that there becomes more of a flattening, so to speak, of the team approach, as opposed to the allopathic doctor at the top and everybody else is sort of down here feeding this and being fed from this core source. There is more of a parity, and there is an understanding that all of the different disciplines are really melding together into a greater unified approach. Patient's physiologic condition is just important to view that from the perspective of homeopathy and the perspective of naturopathy and energy medicine, as it is from the perspective of pharmaceutical medicine. And in that viewing, there comes to be a greater understanding and a greater knowledge base that is shared by everyone. If we take a pharmacologic approach and at the same time there are botanical approaches that are being taken, what is the optimal mix of that? Is there a sequence? Is it better to do something first that is more along the lines of a pharmacologic approach and then graduate that patient into the more botanical approach, for example? Well, those decisions are made jointly in an integral environment. The second aspect of this would be to really look at from the standpoint of the patient's orientation, herself, himself. When we're looking at integral, we're looking at all of the directions at the same time. We're not stretching things out in a simple linear mode to say, well, first let's take care of these important things that's per these priorities, their vital signs, or their high blood pressure, or whatever, because then there tends to be the sense that, well, if you make certain things a certain priority, then you get into the question of how do you treat that priority. And usually the traditional prevailing approach is the conventional medical pharmaceutical approach. However, from an integral awareness and an integral medicine perspective, we have an understanding that we have to first be willing to get into the field of reasoning and the field of experience of the patient herself, himself. Integral medicine then begins to go much further into that understanding of where the patient is coming from, what is their orientation. And that is so important. You cannot administer medication, and you should not administer medication to a person who believes that that medication is toxic to them. You have introduced a whole nother layer of conflict within the psychoneuroimmunologic axis of that patient. Now the person is concerned and fearful and expecting to have serious illness or side effects from the medication that you are giving. But if you're insisting to that person that they take this medication because they have to take this medication, they in essence have no choice, then that is not going to be consistent with an integral approach. The integral approach, as I mentioned in the beginning, has to also elevate the patient to be on par with the treatment team. The belief sets of the patient, their energy set, their state of being, their overall energy levels, these are just as much a part of the factoring as any so-called objective indications that we have from laboratory tests or x-rays or things of this nature. I know I'm going to need to go much further into this process to keep these segments manageable. I think we'll take a wrap up at this moment and then take a break and then come back and continue forward into a greater discussion of what the integral medicine looks like.
Thank you.
Thank you.